Okay, so I want to talk about your ICA that you have on this obtaining authorization ICA, okay, here under session 20. And if you don't see all three of these lines in your Canvas, contact your campus director because it hasn't been published. See over here, you guys can't see this part. It's on my side. But see how those don't have a green check mark? It means it's not published to students. So I'm going to have to fix that. But I can't fix it for every campus because I don't have access to every campus. So if you don't see this, contact your campus director. They can publish it for you. However, I want to show you what you're going to see. So let's talk about authorizations for a second. So I'm going to go back here to the textbook. And if the patient has to have something authorized, I want to talk about referrals and authorizations are not the same thing. A lot of students think these words are interchangeable, and they're not. A referral is given by your doctor. An authorization is given by your insurance company. So if you want to go see a specialist, the doctor probably has to write a referral. But if you need some diagnostic testing like an MRI or a CAT scan, the doctor probably has to get authorization from the insurance company. The best thing you can do for customer service to your patients is inform the patient that this is needed. If this is not needed, the patient can go tomorrow and get an MRI. But if they need to have an insurance authorization, they're not going to be able to have that test for at least a week because it takes time. So you want to inform your patient that there is an approval process that takes time. That way they can understand how it goes. Normally, the authorization has to be put in by the primary care physician because it requires clinical information. And if I work at the MRI center, how do I know why the patient needs an MRI? I just know you want it done. The doctor, who is your treating doctor, is the one who knows why it's needed. So this needs to come from the primary care physician. Okay. Sometimes when a doctor, your primary, sends you to see a specialist, they may send you to see another specialist, and that's called tertiary care. I should have talked about that in the first lecture, but covering it now. Tertiary care, if you look up in the dictionary, tertiary means third, guys. So you got your primary, you got the specialist, you got the extra specialist. Give you an example. I had this growth under my eye not that long ago, and it just kind of popped up over a couple of weeks, but it had never been there before. And I went to see my family doctor, and he goes, I don't know what that is. I'm going to send you to see an ophthalmologist, which is an eye doctor, to have him look at it. So I went to the ophthalmologist, and he looked at it and said, yeah, it needs to come off, but I'm not the doctor to do it. I think because it's so close to your eye, you need to see a plastic surgeon who specializes in eyes so that you don't have this big old scar when you get done. So I went then to that next specialist to have the next evaluation to have this thing removed from my face. Okay, so that's when a specialist may not be the one who wants to take care of you. There may be a reason why they want you to go to see someone even more specialized than them. Or you might take your child to like a urologist and they say you need a pediatric urologist, get more specialized. Okay. So with this ICA, we're going to open up the instructions. And I know this might be small for you, but I'm going to read it. So if it's small, it's okay. This here says, and yeah, you got to read the directions. I'll have had students go, I have no idea what to do with this form. Like, did you read it? No. Once you read those 2 paragraphs, and I bet you it makes sense. Directions. Complete a treatment authorization form for Mrs. Cohn's managed care plan to obtain permission for the office consultation and date it August 2nd of the current year. To obtain the information, refer to the new patient form completed by Mrs. Cohn when she came to our office with Dr. Practon. Dr. Practon is who we work for. And Dr. Practon's family health plan provider number is FHP. There you go. So Dr. Practon takes care of this patient. This patient has family health plan insurance, which our doctor participates with, and it needs a referral for this visit for this doctor we want to send her to. Here's the scenario. Meriwether B. Cohn, primary care physician, Dr. Practon, took her clinical history. Physical examination revealed normal blood pressure, 120/80. However, abnormal heart sounds were heard, and a diagnosis of a heart murmur was made. Dr. Practon decided to make a semi-urgent request to refer Mrs. Cohn for a cardiac consultation, other service, that means something later, to Dr. Victor M. Salazar, whose office is located at, gives us his address and phone number. Dr. Salazar is going to take a detailed history, perform a detailed exam, and make a low complexity medical decision to evaluate Mrs. Cohn's heart murmur. Those of you who are familiar with E&M coding, I hope when I said detailed history, detailed exam, and medical decision making of low complexity, hopefully that rang a bell. Ding, ding, ding. I can code this because that's exactly right. Okay. The very next page is the paper that Mrs. Cohn filled out when she became a patient in our office. So this has her name, her date of birth, social security number, her address, all her information. Guess what? You're going to need that. This is her insurance. This is her policy number. So when they want to know her policy information, there it is. Okay. So what you're going to do is take this information along with her information and fill out the authorization request. Okay. You can use this link to download the PDF so that you can write on it. And it says, go a little bigger here. What is this we're doing? It's a referral. This is the part we have to fill out. And this is very similar to what I fill out daily basis asking for referrals. Okay. So patient's name, the date, is she male or female? How old is she? All this information. What is the clinical history? Why are we sending her to a specialist? Well, she had normal blood pressure, but she had a heart murmur. What was her diagnosis? Heart murmur. What did we do to date? Means what did we do already? Well, we did an exam. Okay. The reason for the referral, we want her to see a specialist. Guess what? We have to code the heart murmur. We have to code the exam we did. Let me scroll up. Was it an accident? Well, heart murmurs aren't really accidents, so no. Where did it occur? You can leave it blank. What kind of visit is it? Oh, I saw one of those words in the history. Go back and read it. Where's it going? We're sending her to the office. Okay. Where did it say who? Oh, yeah, there it is. Who are we sending her to? Who's the doctor we want her to see? We're going to fill all that information out. And you're going to take it from those 2 paragraphs we read, and you're going to put it all on here. Okay. That's how you do it. Then once you have it all, come back to your canvas. Oops. And you're going to upload it here where you submit the assignment. So jump on the Zoom meeting if you have any questions. You can always email me directly. So give it a try. I bet you can do more than you think you can.